this is really for us at MPP a dream come true. To see such a coalition come together. Because as we decided to move our model for voluntary licensing into NCDs, we realized that licenses are very important, but they're only a bit of the picture. And without this holistic approach, honestly, we could have nice cheap drugs that would just sit in a warehouse. So when we realized this, one of the first things we did was to reach out to patient organizations or kind of key civil society organizations in different disease areas. And when we reached out to Carey at UICC and said, do you think maybe we could have a memorandum of understanding? It became apparent very quickly that we had quite a small dream. Carey had this enormous dream that is actually in reality here today. And Carey really took this and ran with it, and it was lovely to see Anil saying that the board of UICC were absolutely behind it. And then all of you coming in and realizing that actually this is something we could do together. And you know, I think there's still organizations out there that are thinking of joining, and I really hope that they will. Access to medicines through voluntary licensing is only one way of doing it, and I'm so pleased that there are different models here, that this is really an inclusive approach, that all the people doing different sorts of great work in cancer are all included in this. But we do think that voluntary licensing has a very important role to play, and it was noticeable that the Essential Medicines Committee of WHO in their recent report called on us to try and address the pricing issues on cancer through voluntary licensing. So once again, it's pretty obvious why we joined this coalition, I think. And it's so wonderful to see you all. But as Anil said, there are going to be some challenges ahead. But if we're starting like this, I really think we can do it. So thank you so much.